Today, raising livestock and poultry of all kinds is growing in popularity, from owners of backyard flocks to herds grown for family use to those who raise poultry or livestock for a family income. For owners of livestock or poultry, keeping their animals healthy is a top priority. Many infectious diseases can cause serious problems. They can make a producer's animals very sick or even kill an entire herd or flock. They are invisible foes that can strike animals when least expected. Normally, most livestock and poultry diseases are not a threat to humans. Diseases can enter any size herd or flock intentionally or unintentionally. Biosecurity is the primary tool a producer has for protecting their animals from disease. Bio means biological and refers to both animals and the germs that can infect them. Security means safety against germs. Biosecurity for raising livestock and poultry is similar to the strategies that we use every day to protect ourselves from many human diseases. We wash our hands and we avoid eating foods that we think might be contaminated. We wash our dishes and avoid contact with people suffering from flu or colds because we know that even a handshake can transmit germs from one person to another. We must protect our livestock and poultry not only from devastating foreign animal diseases like foot and mouth disease and the highly pathogenic avian influenza, but also from infections with common livestock and poultry diseases that may occur frequently in local areas. Guarding animals against disease is accomplished in two ways. First, through an animal's own disease resistance, and second, by preventing, minimizing, or controlling an animal's exposure to germs that cause disease. While developing and maintaining biosecurity can be challenging, it is the cheapest, most effective means of keeping animals healthy, and no disease prevention program will work without it. While the scale of biosecurity practices will differ between large and small operations, their root principles are the same regardless of the size of the operation. Biosecurity practices should always be designed to isolate animals from germs that cause disease. We must always keep in mind that biosecurity can be improved in most operations. Infectious diseases such as the foot and mouth disease and avian influenza are easily spread by the movement of animals, people, equipment, vehicles, pets, clothing, machinery, insects, and rodents, and contaminated materials. The germs which are present in manure and other excretions from infected animals can easily contaminate hands, shoes, cages, and equipment. More specifically, germs and diseases can be spread by contact with sick animals, healthy-looking animals incubating disease, or the introduction of healthy-looking animals who have recovered from disease but are still sources of disease germs. The movement of vehicles, equipment, visitors, employees, and even family members between farms or from one group of animals to another. The clothing and shoes of anyone who has contact with sick animals. Hand tools and equipment that have been used around sick animals. Dead animals that have been improperly disposed. Infected or contaminated feed or feed ingredients. Water sources that have been used by sick animals or that receive runoff from sick animal areas. Contact with manure and dust from sick animals. Contact with companion animals and wildlife that have been infected with or exposed to a particular disease. Biosecurity has 5 major components. Assessment. Assessment of the potential for disease-causing germs to enter a facility is the first step in developing a biosecurity plan. This assessment should include a general evaluation of the potential for contamination from outside sources such as livestock, poultry, wild animals, contaminated feedstuffs, and equipment entering an operation. The physical security and proximity of a farm to other farms raising similar animals needs to be evaluated as well to determine the potential for animal exposures and the potential for cost-effective biosecurity control. Anyone who works with the animals on a regular basis should participate in the development of the biosecurity plan. The assessment and the biosecurity plan should be reviewed anytime an operation changes in a manner that could impact the animal's potential for exposure to disease. Remodeling, expansion of the facility, or new equipment may prompt a new biosecurity procedure. Resistance. Resistance refers to an animal's natural ability to reject or fight a disease. Resistance can be improved through good animal husbandry and through the use of vaccines. Good husbandry and management should provide proper nutrition and minimize stress from such things as the environment, overcrowding, and rough handling. Good nutrition and reducing the animal's stress increases its ability to naturally fight disease. Vaccinations are used to build an animal's resistance to specific diseases. Vaccines are not available to protect livestock from all diseases. Even the limited use of vaccines for more common diseases will greatly strengthen an animal's ability to fend off infection and increase an operation's biosecurity. Producers should always try to purchase vaccinated animals and animals with current health certificates. Isolation. Isolation refers to the prevention of uncontrolled contact between animals, both domestic and wild. This is commonly accomplished through animal housing designs, as seen in confinement operations, or through more simple means such as fencing pastures. Producers should separate animals by species, age, or production phase. Animal handling and housing areas should be cleaned and disinfected between each group of animals as they are moved out. New additions to a herd or flock, as well as animals returning from a fair or exhibition, should be isolated from resident animals for several weeks. This will keep them from bringing disease back to their herd or flock. Specific isolation times and procedures should be discussed with a veterinarian or an extension educator. Traffic control. Traffic control refers to controlling the movement of people, animals, supplies, and equipment on and off an operation, especially relative to potential contact with the producer's animals. Adding new animals to a herd or flock and human traffic are likely to pose the greatest risk to animal health on an operation. Properly managing these two factors should be a top priority for any producer. However, traffic control should address more than vehicles and people. It should include controlling the access of all animals. To start effectively controlling the movement of potential disease-carrying animals, objects, or people into animal housing and handling areas, a producer must identify a farm's biosecurity control area, also known as the clean area. The outside boundary of the clean area should be clearly marked with signs. This boundary represents the barrier between clean and dirty areas of the operation. The clean area covers all parts of the operation that animals can access and where animal handling equipment and supplies are stored. The dirty area comprises everywhere outside the clean area and should be considered contaminated by the presence of germs. Nothing should be moved into the clean area without being cleaned and disinfected first. Without this fundamental biosecurity precaution, contamination or disease can easily be carried into animal living or handling areas by family members and workers, especially after visits to high-risk places such as livestock auction markets, live bird markets, county fairs, livestock and poultry shows, a neighbor's farm, or even feed stores. Anyone coming in contact with sick animals can spread disease if they fail to follow cleaning and disinfection protocols. To minimize contact with sick animals, a producer should isolate sick and potentially sick livestock and poultry. These animals should be cared for last, dealing with healthy animals first. If this is not possible, workers must clean and disinfect themselves and also put on clean clothing prior to working with healthy animals. Another source of disease spread can be associated with dead animals. For this reason, rendering trucks should have access to the carcass removal area without ever being in close proximity to healthy animals. To minimize the chance of contamination or disease reaching animals, producers should take the following actions related to anyone entering the clean area of the farm. Restrict the control access. Verify and record names, tracking who has access to animals. Provide clean coveralls and boots. If the visitor raises the same types of animals raised on the operation, prevent any contact with the operation's animals. Enhance security to prevent uncontrolled and unmonitored access. And at the very least, post security signs, establish a buffer zone or perimeter fence to separate animals from the public, lock all access gates, and establish visitor or intruder policies. Sanitation. Sanitation addresses the cleaning and disinfection of materials, people, and equipment as they enter the clean area on a farm. This includes the cleanliness of the animal living areas. Washing and disinfecting hands before handling animals is a fundamental concept in sanitation. Sanitation is important in all aspects of livestock and poultry production, ranging from the simple cleaning and disinfecting of tools such as feed scoops, shovels, and brooms, to more complex jobs like cleaning and disinfecting animal living areas, vehicles, and large pieces of equipment. Sanitation always involves a two-step process: cleaning and then disinfecting. Disinfectants will not be effective in the presence of mud and manure. Therefore, the first sanitation step is removing all of this material. Cleaning is commonly accomplished by scrubbing with soap and water. A long-handled brush can be used to clean tools, small equipment, and the soles of boots. Producers should provide proper cleaning tools to remove caked-on dirt, manure, and dust. Electric power washers may be options for cleaning large equipment, vehicles, and animal living areas. Once surfaces have been thoroughly cleaned, the second step in sanitation is applying a disinfectant according to the label directions. Poor sanitation relative to vehicles and trailers can increase the chance of disease that could spread along routine routes of transportation associated with feed delivery, animal movement, and other farm deliveries. Vehicles entering a farm, especially if they are entering the clean areas, should be cleaned and disinfected before entering the clean area. When cleaning and disinfecting vehicles, producers should pay careful attention to tires and undercarriage that may hide mud and manure containing germs that cause disease. Poor sanitation of animal living areas can increase the potential for a disease outbreak in a herd or flock. Excessive manure accumulations increases the risk of exposure to disease-causing germs that generally lower animals' resistance to disease. To reduce this potential, manure should be removed from animal handling and housing areas on a timely basis. Producers should dispose of all soiled bedding, manure, waste feed, and other debris between restocking with animals, and thoroughly clean and disinfect animal housing and handling areas between restocking. Producers evaluating 5 components of biosecurity will be well on their way to developing a plan to protect the health of their animals. For assistance in evaluating these 5 components or in developing a biosecurity plan, producers can get assistance from their veterinarian or a local extension educator. Producers can further protect the health of their animals by knowing the warning signs of infectious diseases and when it is critical to contact the veterinarian. This simple piece of education is vital in maintaining the health of livestock or poultry and in protecting Nebraska's diverse agricultural industry. If a producer identifies any of the following signs of disease in their herd or flock, they should immediately contact their herd or flock veterinarian, the state veterinarian in Lincoln at 402-471-2351, or the USDA APHIS area veterinarian in charge at 402-434-2300. A sudden and unexpected increase in the number of animals sick or a number of animals dying from an animal disease. Vesicle or blisters on the lips, in the mouth, or on the teats, or on the hairline of the hoof. Abortions of unknown cause. Central nervous system signs of disease such as staggering, head tremors, falling, circling, or inability to stand. Unusual infestations of maggots and wounds. Severe respiratory disease that suddenly affects a large number of animals. Sick or dead animals that may have been caused by a toxic substance. Sudden death in animals with bloody drainage coming out of the nose, mouth, or rectum soon after death. Warning signs specific to poultry may include any unusual drop in egg laying or unexplained weight loss, greenish watery diarrhea, listlessness, muscular tremors, drooping wings, twisting of the head and neck, or complete paralysis, swelling around the eyes and in the neck, lameness, or tumors. The critical biosecurity step of reporting is worth repeating. Producers should report sick animals with these signs of disease either to their veterinarian, the Nebraska State Veterinarian at 402-471-2351, or the USDA Area Veterinarian in charge, who can be reached at 402-434-2300. Biosecurity should be a priority for all producers, regardless of the size of their operation. Even a single animal in a 4-H project requires biosecurity to maintain its health and the health of neighboring animals.